Welcome to our COVID support webinar for offices and contact centres. We appreciate that there is a lot of uncertainty and worry at the moment across a number of business sectors, so our focus during the webinar here today is to offer you support and guidance on what is legally required of you, looking at your COVID-19 workplace risk assessment, outbreak management, and to provide you with information relating to testing sites and vaccinations. At the end of this webinar, we will provide you with an FAQ document, a link to this presentation, and our email address to keep to hand. Now, which businesses are now allowed to open under Step 4 of the Government Roadmap? All remaining closed and/or restricted businesses are now permitted to open or fully open their premises, including nightclubs, hostess and sexual entertainment venues, and shisha bars. Although COVID is here with us to stay and the infection rates are continuing to increase, government confirmed that at Step 4, most legal restrictions are now lifted. The removal of the following restrictions applicable to offices and contact centres are as follows. There will be no need to implement social distancing measures which had previously limited capacity. The government is no longer instructing people to work from home, so employers can start to plan a return to the office. Self-isolation exemptions now apply to those in close contact with a positive case. Government have requested and advised that this must be a gradual easing of restrictions within the workplace and for people to take a responsible approach to lifting certain control measures. Your risk assessment will identify which appropriate mitigations are appropriate to adopt, and you will find as we move on that many mitigations will remain as they were. With time, it is expected that you will take fewer precautions to manage the risks of COVID-19. There are restrictions and legal duties that still remain, all of which will assist with the protection and keeping of yourself, your staff and others safe. And it will of course help to prevent the spread of the virus between others. Self-isolation remains a legal requirement and your duties under health and safety law to protect workers and others from workplace hazards. This is the same with other workplace hazards where you are required to risk assess and implement adequate control measures to manage that risk. There are 6 steps to protect yourself, your staff and any visitors during coronavirus. The 6 key points are as follows. Number 1, complete a COVID-19 risk assessment. 2, provide adequate ventilation. 3, clean more often. 4, turn away people with COVID-19 symptoms. 5, enable people to check into your venue. And 6, communicate and train. These 6 priority actions are to make your premises a safer working environment and a safer place for people to visit. Now, what is a risk assessment? Broadly speaking, a risk assessment is a careful examination of what, in your work, could cause harm to people and the ways that you can successfully manage these risks to avoid this harm from occurring. As the responsible person, you must conduct a risk assessment to understand how the virus could be transmitted in your premises. You should think about the way that you conduct your work, how your premises is used, and ways that you can protect yourself and members of the public by identifying factors that could result in transmission of the virus. By identifying these hazards, you can then identify sensible measures to control these risks. An example of a hazard would be touch points such as door handles and taps, and shared objects or items such as keyboards. These touch points create a risk as the virus could be present on these surfaces. To avoid this risk, touch points should be wiped down frequently. And poorly ventilated space is also identified as a workplace hazard, which we will cover with you here as we move on. Staff should be trained on the findings of your risk assessment. They should be reviewed and amended as required. And where there are 5 or more employees, you are required to document your findings. Now, to assist with the NHS Test and Trace service, we are urging offices and contact centres to keep a temporary record of staff and visitors for 21 days in a way that is manageable and secure for your place of work. A record of the name, contact details, date and time of shift or visit is sufficient. We would also encourage you to assist the NHS Test and Trace team with requests for this data if needed. This is for contact tracing and the investigation of local outbreaks. To continue to reduce the risk of spreading COVID-19 when visiting or working in your premises, we request that you continue to incorporate the following. You should allow people to continue to distance themselves from others with distance stations, fixed teams located within certain areas to prevent mixing. You should think about your capacity and home working and have a look at whether staff can still continue to remain working from home. And is it a case of being more productive from home, as well as reducing the need for exposure to others? And also, are there options for home and office working throughout the week? Continue to perform online meetings where possible. Use one-way travel routes still, including entrance and exit points. Continue to use floor markings and posters throughout, for example, for testing, those presenting with symptoms, and use of hand gels. Preventing the use of shared items and hot desking, providing individuals with their own equipment to assist with this, and ensuring that you have a system in place to ensure adequate cleaning between uses. Time slots for teams and breaks is recommended to prevent overcrowding of breakout or restrooms. Where you are already using PPE in your workplace to protect against non-COVID-19 risks, you should continue to do so. Any use of PPE should be determined by an assessment of risks in the workplace. Workplaces should not encourage the precautionary use of PPE to protect against COVID-19 outside of clinical settings or when responding to a suspected or confirmed case of COVID-19. Unless you are in a situation where the risk of COVID-19 transmission is very high, your risk assessment should reflect the fact that the role of PPE in providing additional protection is in fact extremely limited. However, if your risk assessment does show that PPE is required, then you must provide this PPE free of charge to workers who need it. PPE must also fit properly. As you are aware, it wasn't previously a legal requirement to wear a face covering within an office space. It was best practice when entering and moving around the building. As general restrictions around face covering compliance have eased, we are now being asked to take a responsible approach. We therefore strongly advise at this time that you continue to ask staff and visitors to wear a face covering just before they enter, and also to wear one as they move around the premises, such as to use the toilet or when making a drink. You need to consider the reasonable adjustments needed for staff and members of the workforce with disabilities. And you also need to consider carefully how this fits with other obligations to workers and the public arising from the law on employment rights, health and safety, and equality legislation. Some people are not able to wear a face covering, and the reason for this may not be visible to others. Please be mindful and respectful of these circumstances. If your worker does choose to wear a face covering, you should support them in using face coverings safely. This means telling them to do the following. Workers should wash their hands thoroughly with soap and water for 20 seconds, or use hand sanitizer before putting a face covering on and before and after removing it. When wearing a face covering, workers should avoid touching their face or face covering, as they could contaminate them with germs from your hands. Change their face covering if it becomes damp or if they've touched it. They should continue to wash their hands regularly. Change or wash their face covering daily. And if the material is washable, to wash in line with the manufacturer's instructions. And if it is not washable, then they should dispose of it carefully into the usual waste stream. Hand washing remains a key control measure to help to prevent the spread of the virus. You should ensure that you have a designated hand wash basin or basins located in convenient locations with a supply of hot and cold running water, liquid soap and paper towels for hand drying. Hand sanitising stations should be placed at the entrance, toilets, printers and other areas throughout the premises. You should request that staff and visitors use these as they enter. Staff should be actively encouraged to wash their hands as often as possible and for at least a minimum of 20 seconds. Now, keeping your premises clean. COVID is carried in the air through tiny droplets, and larger droplets can land on surfaces that they touch, while smaller droplets, called aerosols, can stay in the air for at least 5 minutes if there is no ventilation. Therefore, cleaning your premises is a crucial part to achieving compliance and controlling the spread of the virus. You should implement a strict cleaning regime, focusing on touch points such as door handles and taps on all hand wash basins and any shared object or equipment. We recommend that you have a designated staff member who takes sole responsibility for these tasks and that frequency is high, especially during busier days or, for example, when meetings or conferences take place. You should continue to use the normal antiviral cleaning products that you have been using. However, there is a British Standard product available, BSEN 14476, that is recommended, but it is not compulsory, and you will see this on the back of cleaning products. Please ensure that you do have adequate waste provisions for cleaning materials to be disposed of safely. Now, ventilation. Good ventilation brings fresh or cleaned air into indoor spaces. The more fresh air that is brought inside, the more diluted any airborne virus will become. In poorly ventilated spaces, residual virus can remain in the air after an infected person has left and increase the risk of COVID-19 spreading. You should maximise the supply of fresh air in your premises, and you can do this through the following: by fully or partially opening windows, air vents and doors to improve natural ventilation. If you are using mechanical ventilation, ensuring that your systems are set to maximise fresh air and minimise air recirculation. Maximising the amount of fresh air your system draws in or ensuring additional fresh air will help avoid COVID-19 spreading. And you should identify any poorly ventilated spaces as part of your risk assessment and taking steps to improve fresh air in these areas. The priority of your risk assessment is to identify areas of your workplace that are usually occupied and are poorly ventilated. Many of you will have smaller spaces. You should therefore prioritise these areas for improvement to reduce the risk of aerosol transmission. The HSE provides guidance on how to identify poorly ventilated space, and it also explains steps that you can take to improve ventilation within these areas. If you can't improve ventilation within these spaces, you should consider whether it's safer to restrict the time spent within these spaces and the number of people that access these spaces, or to stop using them at this time. Our Trade with Confidence page does contain important information regarding the use of CO2 monitors and how CO2 monitors can help to identify poorly ventilated areas. Please take a look at this section on our website for more information. However, just for reference, where there is continuous talking or crowded spaces, providing ventilation sufficient to keep CO2 levels below 800 parts per million is recommended. Now, testing and isolation. LFT testing should take place twice weekly. Those who present with symptoms or test positive following a positive LFT test result should isolate and arrange for a PCR test. Now, when do my staff need to isolate? If they are symptomatic, that applies to the vaccinated and unvaccinated persons. If positive via an LFT and whilst awaiting a PCR test, again for the vaccinated and unvaccinated. And if their PCR test result is positive, again this applies to the vaccinated and unvaccinated individuals. When they are returning from amber countries and staff are unvaccinated, and when returning from red countries, which currently requires quarantine isolation within an MQS site. The gov.uk website will provide you with further information regarding restrictions on travel. You do have legal responsibilities to ensure compliance and must not encourage nor ask someone to work whilst they are required to self-isolate. You as the employer and your employee will be liable for legal action in the form of a fixed penalty notice and or prosecution for any breaches. Now, from the 16th of August, you will not be required to self-isolate if you live in the same household as someone with COVID-19, and any of the following apply. If you are fully vaccinated, you are below the age of 18 years and 6 months, you have taken part in or are currently part of an approved COVID-19 vaccination trial, or if you are not eligible to get vaccinated for medical reasons. Fully vaccinated means that you have been vaccinated with an MHRA approved COVID-19 vaccine in the UK, and at least 14 days have passed since you received the recommended dose of that vaccine. If you are not legally required to isolate and fit into the above categories, you will be provided with advice on testing and given guidance on preventing the spread of COVID-19. Even if you do not have symptoms, you will be advised to take a PCR test as soon as possible. You should not arrange to have a PCR test if you have previously received a positive PCR result in the last 90 days, unless you have developed any new symptoms of COVID-19, as it is possible for PCR tests to remain positive for some time after COVID-19 infection. Even if you are vaccinated, you can still be infected with COVID-19 and pass it on to others. If you are identified as a contact of someone with COVID-19, but you are not required to isolate, you can help to protect others by following the guidance on how to stay safe and help to prevent the spread. As well as arranging a PCR test, you may also consider the following: limiting close contact with other people outside of your household, especially in enclosed spaces. Wear a face covering in enclosed spaces and where you are unable to maintain social distancing. You should limit contact with anyone who is clinically extremely vulnerable, and take part in twice weekly LFT testing. Please consider within your workplace risk assessment for enclosed spaces, and if it is best practice to request that office staff identified as close contacts remain away from the workplace and work from home for the 10-day period. We will provide you with the gov.uk web links via our FAQ document for further information. Now, what is an outbreak? An outbreak is a sudden increase or occurrences of a disease within a location through person-to-person contact or from the environment. If you become aware of 2 or more positive cases of COVID-19 over a 14-day period within your workplace, you should contact Public Health England on telephone number 0344 225 3560. Follow option 0 and then option 2. There should be a lead point of contact within the business to control and manage such incidents. This lead person should immediately identify any close workplace contacts and advise them to self-isolate where required. You should not wait for the NHS test and trace team. This prompt action will help to reduce the risk of a workplace outbreak. If the local public health protection team declares an outbreak, you will be asked to do the following. You'll be asked to record details of staff with symptoms of COVID-19. And you'll be asked to help to assist with identifying any contacts. You should therefore ensure that all employment records are up to date, and you will be provided with information on the outbreak management process. Should you fail to get through to the public health team, please contact our local public health team on the email address provided at the end, where they will be happy to help you. Please also contact Environmental Health COVID Business Support for assistance and advice in relation to workplace enhanced cleaning and any other additional support that you may require. We will also provide you with the guidance to cleaning the workplace for non-clinical settings where there is a suspected or confirmed outbreak. Now, other areas that you should consider. There are some groups who are at higher risk of severe illness from COVID-19. Please see the guidance on who is at higher risk and protecting people who are clinically extremely vulnerable for further support. You should give extra consideration to people at high risk and to workers facing mental and physical health difficulties. Those who are clinically extremely vulnerable are no longer advised to shield. However, you should continue to support these workers and any visitors by discussing with them their individual needs and supporting them in taking any additional precautions advised by their clinicians. Please remember to consider providing support for workers around mental health and well-being. And as an employer, you have particular responsibilities towards disabled customers and the workforce, and also new mothers or those that are pregnant. Please ensure that you carry out an individual risk assessment for their needs. Meetings and training should be held via alternative means still, such as via online platforms, and any work-related travel should ideally be done alone and not via car share. Now, many of you will have seen or have been issued with a COVID compliant sticker by an officer from within the team following a site visit. The City Council introduced our COVID compliant recognition scheme to acknowledge the good work of businesses across the city and to provide the public with a level of reassurance that businesses across the city are in fact safe to visit. Since this, the Council has introduced a COVID compliance grant scheme available to all businesses, including the voluntary sector and the self-employed, to recognise your hard work and to help you with means of operating safely, such as for funds for hand sanitisers, cleaning supplies, posters, and anything else which may assist you. We've received over 230 applications so far and urge those of you that haven't already applied to please do so. We will provide you with the details as to where to apply via our FAQ document afterwards. Businesses with 5 or less employees are entitled to £500 and those with 6 or more £1,000. Once the application has been submitted and accepted by our grants department, an officer within the COVID compliance team will make contact with you to arrange an appointment to visit you. During this visit, the officer will run through the COVID-19 risk assessment and your control measures. They will also offer you any support or guidance that is needed. You'll be issued with a COVID compliant sticker should you comply, and your business details will be listed on the council website as a COVID secure premises. We also encourage you to display your sticker in a prominent position so that it can be easily identified by members of the public. Testing and vaccinations. Now the following few slides show vaccinations and testing information. It includes walk-in vaccination centres and test sites for symptomatic and asymptomatic testing. Please do make contact with us should you have any questions or concerns, and we will be happy to help you. Thank you for your time here today and for listening, and we wish you all the best with the next stage of the government roadmap. Please remember to be safe and most of all to be kind to one another.